So I think it's quite refreshing from a ophthalmology, even from a doctor perspective, to think that AI or technology is not a threat, but it's an opportunity. And that from the high cutting edge technology trickle down towards a general perspective and allowing more people to practice and helping more people. It's a very refreshing perspective from like a doctor perspective. So on that note, actually, I want to ask more about like from DMEK, and also because some of our viewers may not know what DMEK is. So can you explain more about it, and why is it kind of transforming from PK to DMEK? Why is it so important right now?
Yeah. So PK was a sort of the first corneal transplantation procedure that was described back in even 1905. And essentially what you do is you change all the layers of the cornea. So all the 5 major layers of the cornea change. And then really probably since early, like late 90s, endothelial keratoplasty really came around, became a little bit more popular. And that was basically where instead of changing all the layers, just through a keyhole incision, we just changed the inside layer. And that really changed a procedure that had a recovery time of almost 9 months to a procedure that you could actually start to see reasonably okay, even by 3 months, basically after surgery. So that's a massive difference. And instead of 16 stitches on the surface, you just had basically 1 or 2 stitches basically from the incision where you put the graft inside the eye. DMEK took this further, where the graft that we insert, instead of being 100 microns thick, we made it down to almost about 30 microns thick. So the visual recovery was even faster than what we saw with basically DSEK surgery and stuff as well. And that's really, become the sort of gold standard for treatment for patients with endothelial dysfunction. The downside, of course, is because the tissue is so thin, technically it's quite difficult to do the surgery itself. And so that's been one of the hindrances with a lot of people basically doing the procedure. But it's allowed patients to see tremendously well. It's also been shown that rates of rejection following surgery is quite low as well with a DMEK procedure compared to the normal full thickness procedure. And it's really revolutionized corneal transplantation surgery because it is still the leading kind of transplant that most people will do.
So I had the opportunity to see you do a corneal transplant to DMEK, and I'm very mesmerized by how thin the tissue is. And then when you insert it through the apparatus and into the cornea, and then it kind of folds into the inner layer of the cornea, it's kind of amazing. So I remember that you have developed some technology and also some apparatus towards specifically for these technology. Can you talk about them? How do you develop these apparatuses?